What causes gastritis? Gastritis occurs when something damages or weakens the stomach lining, mucosa. Different things can trigger the problem, including alcohol abuse. Chronic alcohol use can irritate and erode the stomach lining. Autoimmune disease. In some people, the body's immune system attacks healthy cells in the stomach lining. Bacterial infection. H. pylori bacteria are the main cause of chronic gastritis and peptic ulcer disease, stomach ulcers. The bacteria break down the stomach's protective lining and cause inflammation. Bile reflux. The liver makes bile to help you digest fatty foods. Reflux means flowing back. Bile reflux occurs when bile flows back into the stomach instead of moving through the small intestine. Medications. Steady use of nonsteroidal anti-inflammatory drugs, NSAIDs, or corticosteroids to manage chronic pain can irritate the stomach lining. Physical stress. A sudden, severe illness or injury can bring on gastritis. Often, gastritis develops even after a trauma that doesn't involve the stomach. Severe burns and brain injuries are two common causes. How is gastritis diagnosed? Your healthcare provider will ask about your symptoms and history and perform a physical exam. Your provider may also order one or more of these tests. Breath test. During an H. pylori breath test, you swallow a capsule or liquid containing urea, a harmless radioactive material. You then exhale into a balloon-like bag. H. pylori bacteria change urea into carbon dioxide. If you have the bacteria, the breath test will show an increase in carbon dioxide. Blood test. A blood test checks for antibodies titers that fight H. pylori bacteria. Stool test. This test checks for H. pylori bacteria in your stool, poop. Upper endoscopy. Your doctor uses an endoscope, a long thin tube with an attached camera, to see your stomach. The doctor inserts the scope through your esophagus, which connects your mouth to your stomach. An upper endoscopy procedure allows your provider to examine the stomach lining. You may also have a tissue sample, biopsy, taken from your stomach lining to test for infection. Upper gastrointestinal, GI, exam. During an upper GI exam, you swallow a chalky substance called barium. The liquid coats your stomach lining, providing more detailed X-ray images. What are the complications of gastritis? If left untreated, gastritis can lead to serious problems, such as anemia. H. pylori can cause gastritis or stomach ulcers, sores in your stomach, that bleed, thereby lowering your red blood counts, called anemia. Pernicious anemia. Autoimmune gastritis can affect how your body absorbs vitamin B12. You're at risk of pernicious anemia when you don't get enough B12 to make healthy red blood cells. Peritonitis. Gastritis can worsen stomach ulcers. Ulcers that break through the stomach wall can spill stomach contents into the abdomen. This rupture can spread bacteria, causing a dangerous infection called bacterial translocation or peritonitis.